Thank you, sir. Good afternoon to all the respected teachers and everyone present. The title of my paper is Serum Vitamin D Levels in Women with and Without Uterine Fibroid. Uterine fibroids are monoclonal tumors arising from the smooth muscle cells of the myometrium, and they are the most common benign tumors of the female genital tract, and are associated with a large volume of extracellular matrix proteins such as collagen, proteoglycan, and fibronectin, accompanied by increased smooth muscle cell proliferation. The exact cause of uterine fibroid is not known. Therefore, there are no specific methods for prevention. However, certain risk factors such as increase in age, premenopausal status, black race, obesity, family history of uterine fibroids are implicated. Symptomatic uterine fibroid may present with menorrhagia, iron deficiency anemia, chronic pelvic pain, infertility, miscarriage. All these can adversely affect the physical and mental well-being of a woman. Surgical treatment includes hysterectomy and myomectomy, but some women wishes to preserve their fertility. On the other hand, medical treatments are not inexpensive, and there is concern about their long-term use. Studies have suggested that hypovitaminosis D plays a role in the development of uterine fibroid. The active form of vitamin D exerts its effect through its receptor, the vitamin D receptor, which is present in almost all the tissues of the body. Besides calcium and phosphate homeostasis, other functional effects of vitamin D includes reduced cell proliferation, increased apoptosis, enhanced differentiation, and regulation of biological processes such as angiogenesis, extracellular matrix production, and immune response. Vitamin D receptor is found to be present in the myometrium and endometrium of human uterus. Interestingly, uterine fibroid tissues were found to express lower level of this receptor than their adjacent healthy tissues. The objective of our study is to determine serum 25-hydroxy vitamin D level in women with and without uterine fibroid and compare this level between the two groups. This is a cross-sectional study conducted in RIMS Imphal from January 2021 to October 2022. Convenience sampling was done, and two groups were included in the study population. Diagnosed cases of uterine fibroid who attended gynecology OPD or admitted in gynecologic ward were taken as cases, and for comparison, age-matched healthy normal women without uterine fibroid who attended RIMS hospital were taken. Women of age 18 years or older were included, while pregnant women, lactating mothers, menopausal women, women who were on hormonal therapy or vitamin D supplements during or 6 months prior to the recruitment process, and women with malignant conditions, CKD, and liver diseases were excluded. The calculated sample size was 50, and altogether 50 cases and 50 controls were taken, a total of 100 participants. Serum 25-hydroxy vitamin D was measured by ELISA. Approval was obtained from Research Ethics Board, RIMS, and written informed consent was obtained from all the participants. The collected data were analyzed using IBM SPSS version 21, and p-value of less than 0.05 was considered statistically significant. In our findings, we observed that majority of the cases and controls were in the age group of 41 to 50 years of age, followed by 30 to 40 years. The mean age of the cases was found to be 44.78 plus minus 6.04, which was a bit higher than those of control, though the difference was not significant. Majority of the cases and controls were of Hindu religion, followed by Muslim and Christian, though the difference was not significant. Majority of the cases and controls were from urban area, though the difference was not significant. Half of the cases and 32% of the cases had deficient and insufficient level of serum vitamin D, whereas majority of the controls had sufficient level of serum vitamin D, and this difference was significant. The mean level of serum vitamin D level in cases was found to be around 22.6 from plus minus 6.64, and in cases it was around 33 plus minus 6.39. Serum vitamin D level was found to negatively correlate with the size of the uterine fibroid, and this was found to be significant. In our study, the mean age of the participant ranged from 30 to 56 years. Majority belonged to the age of 41 to 50 years, with the mean age of the cases a bit higher than the controls. This was in accordance with study done by Lee et al. Increased incidence of uterine fibroid after the age of 30 could be due to the age-related hormonal changes. Majority of the cases and controls were by Hindu religion and from the urban area. These findings could be due to the fact that the study setting is located in a Hindu-dominated urban area. Majority of the cases had deficient and insufficient serum vitamin D levels, whereas majority of the controls had sufficient serum vitamin D levels. The mean level of serum vitamin D in cases was 22.44 plus minus 6.64, which was much lower than those of the controls, and this was significant. These findings were in accordance with study done by Farzana et al. Serum vitamin D level was found to have a negative correlation with the size of uterine fibroid, and this was in accordance with study done by Sarbai et al. In uterine fibroid, there is an aberrant tissue repair leading to the altered extracellular matrix production, which is the hallmark of uterine fibroid. Vitamin D suppresses this abnormal response by increasing the tissue inhibitors of metalloproteinases, which in turn regulates the matrix metalloproteinases 2 and 9, leading to degeneration of these extracellular tissues. Vitamin D also acts as an anti-fibrotic factor and inhibits the growth of human fibrous cells by reducing transforming growth factor beta-3-induced fibrosis-related genes expression in human uterine fibroid cells. In animal model study, vitamin D significantly reduced the size of uterine fibroid by suppressing genes responsible for cell growth, anti-apoptotic genes, and genes encoding estrogen and progesterone receptors. Our study has some limitations. Firstly, due to the cross-sectional study design, the causal relationship between vitamin D and uterine fibroid could not be determined. Secondly, being a hospital-based study and the small sample size, the findings may not be representative of the general population. Nevertheless, it may be concluded that maintenance of sufficient levels of serum vitamin D may be a potential effective, safe, and inexpensive modality for the prevention and treatment of uterine fibroid. Future prospective cohort studies could share more light on the role of vitamin D in the biology of uterine fibroid. Thank you.